My name's Dr. Lyndsey Williams. I'm a GP in Northwest London, and I'm one of the GP champions working with the West London Hepatitis C operational delivery networks. I also work with Professor Ashley Brown, who is a hepatologist and the clinical lead of the West London Hepatitis C ODN, and Michelle Turner, who's our programme manager. This is a short presentation to talk about the hepatitis C case finding tool in primary care. So I have been piloting the search tool in Northwest London, and I thought that it would be helpful if I shared my findings with you. So as we know, there's the hepatitis C elimination worldwide commitment. So the World Health Organization wants to eliminate hepatitis C by 2030. In England, we know that there's about 62,000 patients still remaining to be found and treated for hepatitis C. Most people who remain undiagnosed or untreated, so about 40,000, are likely to be registered with a general practice or a GP in primary care. So that's where this search was, the idea of the search was originated. So MSD is a pharmaceutical company, and they worked in partnership with NHS England to develop a patient search identification tool. This is much the same as any other search that you would run in your GP IT system. And it pulls out about 1,800-ish codes and can give you actually 47 different search outcomes. So it can do a lot depending on what you want to look at. The four main areas and four main purposes of the development of this search was to identify patients that may be at risk of hepatitis C, that have a confirmed diagnosis but have been lost to follow-up and no treatment recorded, cases who may have received infected blood or infected blood products, and patients with other blood-borne viruses. But as I say, there are 47 other outcomes. So what is the PSI, the Patient Search Identification Tool? So it's available on all GP IT systems. So for EMIS, it already is live in your EMIS already. So if you go into population reporting, EMIS library, SNOMED searches, EMIS clinical utilities, and third-party sector, you'll see the Hep C elimination programme. That's where the search sits. For System 1 practices, if you email England Hep C inquiries, they'll be able to send you the search and you can import it yourselves. Now, you can import it at scale, or you can import it, so you can import it at practice level, PCN level, you can across a borough or collection of PCNs, depending on how your IT system is set up and linked. So for us in Northwest London, we have about 337 GP practices, and we have a mix of EMIS users and System 1 users. So when I first found this tool as a GP clinical lead, I started to approach individual practices. And actually, in the end, I got 80 practices in Northwest London to agree when I reached out to them and said, would you run this search? Then they could send me a screenshot of their overall numbers. So it gave me a flavour really of just how much the search is picking up in those practices and in Northwest London. But then what we realised was, as I was doing this, we are in a very fortunate position in Northwest London where we have something called WSIC, so WSIC. WSIC is the whole system's integrated care data. It's a data warehouse where all primary care data, secondary care data, some social care, some mental health, all gets pulled into this data warehouse. So it's quite unique, and I don't think anywhere else in the country has it. So working with a hepatologist, Dr. Matt Foxton at Chelsea and Westminster Hospital, he had approached WSIC and asked them if he could run the search in WSIC to just give us an overall population health idea of numbers, which they agreed to. So he ran that, and the data is anonymized. And it's through that data that we then, as an operational delivery network, we then looked at that data and thought, right, okay, this gives us an idea of hotspots or areas where they may have a higher proportion of patients that are at risk or lost to follow-up. So what I had to do then, because if we wanted patient identifiable information, we can get that from the WSIC data, but you have to go through an information governance process. So rather than having to go individually practice by practice, getting them to run the search for me, share the results with me, what I did was I went to the North West London Information Governance Committee with my application to re-identify data from WSIC, which they approved. Now, what we decided to do in North West London was focus purely on the two cohorts. So one is those that have ever been positively coded for hepatitis C, and we have no follow-up treatment blood test to see if they've had elimination or not. So those that could be lost to follow-up or an opportunity to offer them treatment. And the second cohort are those at risk of hepatitis C. So once we had the approval from the Information Governance Committee, they had said we obviously must inform the practices that they would be re-identifying the information with to seek their approval. So we went to those practices and we sought their approval. They were happy with what we were doing. And we explained we're going to be doing this in two stages. One is looking at those ever Hep C positive, and then the other one will be the at risk. So the phase 1 Hep C positive ever. So what the WSIC team would do is they would run the search in the practice. They would send the re-identified, so the patient identifiable information would be sent to our Imperial Hepatitis C team. So they're the clinical team at Imperial supporting with this project. And the Operational Delivery Network clinical colleagues would then check those details against their systems. So they checked it against the local database for if that patient had ever been treated for hepatitis C, but they also checked it in the Arden and GEM treatment registry as well. So they were looking at it in lots of different areas to see if we can try and find out the outcome for those patients. So we made a decision to have the codes of you have viral hepatitis C still, or your hepatitis C is resolved. And so then what the Operational Delivery Network did was they then sent the information back to the GP against each of those patients to say hepatitis C is now resolved or they need further testing. And did the practice want to contact them, or were they happy for the operational network to contact them at Imperial? And the practice were happy for the Imperial colleagues to contact their patients. So then it gives the opportunity for the operational network to capture those that have been lost to follow-up and offer them an opportunity to be tested. It also gives the GP practice a data cleansing opportunity where they can then update the patient's records to make sure that they have now got hepatitis C resolved, so they no longer have hepatitis C active against their records. The phase 2 was looking at those at risk. So the at risk search has a couple of elements to it, and what it has is high risk and low risk codes attached. The high risk list would pick out those high risk codes. You can see in the box the ones that are included. We decided in North West London to filter out Hep B, HIV and opiates. We felt that those patients would already be identified, and we just wanted to get the number a little bit more manageable for the phase 2. Again, with the lower risk factors, we again filtered out the Hep B and piercings, but you can see the ones we included. We then worked with the practices. I have 2 other GP colleagues in the network with me, and we also shared the proposed messaging with charities and trusts and got some patient input as well. And we made a decision that this was what the text message would look like, and you can read, and it would be from St Mary's at Imperial London, which is where our operational network lead, our Professor Brown is based. And we also decided to create a website that gives them more assurance that this message is true and correct, and gives them more information, and particularly information on self-testing for hepatitis C. Now, you'll read at any point, we never said you have been identified as someone at risk. We have kept it very light touch to raise awareness of hepatitis C amongst the populations that may be higher risk, because they're not guaranteed to be high risk, because it's all based on coding, and as we know, coding can vary. So we wanted to keep it as light touch as possible, explaining what hepatitis C is, explaining the ease of treatment, and how they can get tested for it. So phase 1 outcomes. So we ran the search anonymized in 337 practices. We then decided to look at 4 practices in particular across Northwest London. And we found 158 patients were coded as hepatitis C positive. However, once that patient identifiable information was shared back at Imperial with the Operational Delivery Network clinicians, they cross-checked that data. And as you can see, 7 of them were lost to follow-up. So 7 out of the 158 were lost to follow-up. 43 were and had been treated. So actually they needed to be recoded because they were no longer Hep C positive. So it's actually 27%, so a quarter of them. 17% of them, they had an antibody positive but a PCR negative. So they had spontaneously probably resolved their hepatitis C. So that's another high percentage, so nearly 20%. So we had a 27% and 17% that out of that 158 were no longer hepatitis C positive, although coded positive in their GP systems. But a big chunk were hepatitis C antibody negative. And unfortunately, that's the code, the search picks up that code when it automatically comes back as a result in our GP IT systems. So that's why it was picking them up, but they were not hepatitis C positive ever. And so the good news is that actually we found 7 out of 158 patients. And then the other best part is that actually 70 of them can be recoded as hepatitis C resolved. So it's a really good outcome. So you can see the opportunity to treat and cure hepatitis, but you can also see the opportunity to data cleanse and make sure that the correct information in patients' records is there. Phase 2, we have just started. So we have run the search, we've got the patient identifiable information. And what we've asked is, we asked each of the 4 GP practices, would they like to send the text message, or would they like us from St Mary's Imperial to send the text message? So 2 of the practices decided that they would like us to send the messages to the patients. 1 practice decided to send it themselves to the patient, and 1 practice we didn't get a response from. So what we're waiting for now is to see whether there's been any change in the patients requesting of hepatitis C tests. So we are just in the process of reviewing, because we only just sent out those messages at the end of February. So it's only been, those messages have only gone out over the last week or 2. So we haven't got any data yet for phase 2. If you want any more information, please contact the england.hepc inquiries at nhs.net for support with the tool. If you want more resources about hepatitis C, please go to the Hepatitis C Later website. And there's also some great CPD accredited hepatitis C awareness training. That's also at the Hep C Later website. So I'm Dr Lyndsey Williams. Thank you for listening.